time is now. Welcome back to the Time is Now podcast. Thank God we could be here together today. On this podcast, we speak to entrepreneurs from all industries and figure out what makes them tick, where they came from, what business means to them, and how they achieve success. I'm Dr. Slava Shut, a doctor of physical therapy, serial entrepreneur, and your host. Welcome, everybody, again to the Time is Now podcast with me, Dr. Slava. I have another one of these fun days where it's just you and I. I answer questions from people sending things in. I think it's very important. When I do this, people really, really get into it. They feel like they're part of the podcast. They feel like they're part of the question and answers. People really, really like being involved. So I have some great questions out there from people. We've gathered some of the top ones. I'm sorry, I can't put every single question in, but keep sending your questions. We'll be happy to answer things. Some of them are really good. Some questions had many parts and almost like required a diagnosis. So remember, when you're asking a question, I'm happy to answer. Some are going to be more detailed. Some of you may want to ask me questions more one-on-one in some ways because some of the questions are more detailed oriented, referring to a person in particular. So I'm going to get to more general people where I can answer the bulk. So here we go. First question. What are the most common injury cover mistakes that you see patients make that impede healing? Well, I'm going to tell you right now. One of the common mistakes people make is they were, let's say, an athlete at one time, and now they're not a super athlete. So they are either hot or cold. They jump into a program, they do things like they used to do back in the day, and the first thing that happens to them, they get hurt. So they get hurt, they're on the shelf for a little bit, they don't do proper physical therapy, they don't take care of themselves well, and they jump in again, get hurt again, and back and forth, and they're never really getting anywhere. The other thing that people do is they smoke. I hate to tell you this, I hate to be a bearer of bad news, but smoking impedes healing. It does. I'm sorry. I treat a lot of women post-plastic surgery. They want to better their bodies, and then they wonder why their procedures didn't go so well. They smoke, and then they go to the doctor and say, how long do I have to quit smoking before we do this procedure? Oh, 2 weeks. Oh, that's wonderful. I can do that. Sorry. 2 weeks is not good enough to clear a system of the years you've been smoking. It doesn't impede healing. Look, the plastic surgeon, God bless her soul, they're trying to make money like anybody else, right? So they'll tell you, oh yeah, 2 weeks. 2 weeks is not good enough. You need longer time to quit smoking and to help your healing. You have to eat right. You have to get some sleep. And by the way, I know this is not easy. To all of you out there listening, cortisol levels, stress hormones, they will impede healing. Okay? So you have to find a way to do the cool out method. We got to relax, bring some things down. If you're constantly in flight mode, your parasympathetic nervous system is haywire. You're in overload. You're constantly go, 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 and you can't focus. You're constantly stressed. Guess what? That impedes healing. So we have to eat right, get away from smoking. We have to get some rest, and we definitely have to do some physical therapy, healing principles that we'll talk about, and that'll get you to heal more completely. When dealing with soft tissue injuries, what therapy modalities do you find most effective to restore average tissue quality and function? So in the clinic, we do things like ultrasound. You have ultrasound waves that travel through a sound head. Inside the sound head, there's a crystal that vibrates really fast with the frequency set by the machine. It sends acoustic stream through gel and through the water's tissue underneath the skin, helps promote healing, helps circulation, basically pushes some of the gunk out, improves circulation, brings the garbage out, and new raw nutrients in. So ultrasound is a very good modality. Electrical stimulation is good. It helps modulate how the nerves work and your perception of pain changes. So it's a good way to modulate pain. Stretching. Stretching is a really good modality. Stretching is very good to increased elasticity of tissue, less pressure on the body. So I tell people stretching is like this. You ever seen a boiling pot and the water's boiling, 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 and it's covered with a lid, and the lid's about to, jump off. But if you move the lid just a little bit, the water's still boiling. However, the pressure changes. So stretching is a really good way to take away pressure, decrease the pressure going on to the system. And if you get your system be a little more elastic, a little more giving, a little more stretchy, there's less pain, pressure. It's a really good thing to do. It's a really good modality. Stretching is great. Calisthenic exercises, strength training, core work, they're all really great modalities to improve, average tissue quality and definitely improves your function. How important is it addressing the mental, emotional aspects of injury and the physical for rehabilitation? Fear of re-injury specifically. Okay, so we've talked about this before. Emotions and your mentality play a big role, big factor in overall healing and recovery. So when you're in an emotional state, if you've ever been angry, you know that you're not thinking clearly and you're just not completely there. You're seeing red, things are boiling, you're hot, and the mental clarity is not all there. When you're in a high emotional state, in pain, you're crying, you're depressed, you're sad, it's going to impede healing. So, addressing all the mental functions is really good. Now, one good way to reduce your emotional state, and remember, there's a major loop in your brain that goes from an emotional state to some of the emotional memory state areas in your brain. We're not getting into anatomy specifically. If you want to, email me, direct message me. I'll give you some of the physiology, exactly what those things are called. But let's go basic. You have pathways in your brain from emotion to memory. And it's a constant loop. The loop goes back and forth. So you're more emotional. You bring up a lot of stuff. You start replaying things in your head. It's over and over again, and you can't really get out of that state. One of the ways to take another pathway to kind of bypass the emotional memory is to use intellect. So you start asking yourself questions. When you start asking questions, you're tapping into higher level intellect. When you tap into higher level intellect, your emotional state goes down. Does it make sense to everybody? So instead of getting super hot or angry or depressed or sad, when you start reasoning and tapping into your conscious centers of thought, you'll notice that your emotional state will go down. So that's very, very important. It's very hard to heal and it's very hard to recover when you're constantly in again, sympathetic state. So you want to get the parasympathetics involved, which are your relaxation system for the most part. And a lot of physiological things function when you're trying to activate the parasympathetic nervous system. And when you use higher level intellect, that brings things down and you start processing things, you start thinking, and a lot of good things happen, and you're going to heal a lot better in that state than a high state of stress, anxiety, sadness, and depression. It's been proven. There's positive literature to support it. So stay positive. Positivity is great healing. For weekend warriors, athletes with 9-to-5 desk jobs, what daily habits cause overuse injuries like tendonitis or impact injury risks? I love this question. So people get into all kinds of bad habits, especially women. Women sit on the one leg in the office chair. They stand with the hip out. There's a lot of things that happen with habits. And this happens to men too. And men sit, slump, and slouch. They're at their desk for 8 hours, typing away, phone calls, typing away. And then they wonder when they go out to play soccer, for their weekly soccer league, okay, why they strain hamstrings, pull their neck muscles, sprain an ankle. I mean, some things are out of control and some things are, if you're sitting like this and you have like a 30-second warm-up session and you're out there trying to do things that when you were 20 years old, you're going to injury city, my friend. So if you're up every 20, 30 minutes out of your office chair and you're moving around, you're doing things, you go to your game, you start a stretching program full of dynamic motions, things that you're going to do on a field, progressively from slower to a little bit quicker, get warmed up, and now you do some drills to get your mind body connected of the things you're going to do specifically. Guess what? You're going to prevent a lot of injuries. So that's going to decrease your injury risk. If you come out of the office and your hips are off and your back is tight and your neck is tight and everything, and you've been stressed all day, guess what? Soccer, baseball, softball, basketball league at your local gym, they're not going to go well. I'm sorry to tell you, but you're increasing your injury risk exponentially. So let's do the smart thing. Could you outline your ideal protocol for ensuring ligament and tendon injuries like ACL tears heal optimally with full range, strength, and stability restored? So I'm not sure if this relates to somebody who actually had ACL reconstructive surgery or they tore their ACL. Let me tell you what my experience of 20 plus years treating ACL injuries, non-surgically and surgically. Basically, an ACL tear that's at least 51% torn is a full tear. It'll at some point, it will be a full tear. It'll be non-functional or it will tear completely. It's just a matter of time. It's not the end of the world, but that's a fact. There's studies to show it. So if you have a small tear in the ACL or a slight stretch, there's healing potential. If you have X amount of tear in the ACL, it's as good as torn. Now, if you have ACL reconstruction surgery, and I've seen people try to attempt this and do rehab on their own, it's been a disaster. I've seen those people where they try to rehab on their own. They've had 3 months, 4 months, 5 months of doing their own, and they're wondering why they're having such complications. The knee feels unstable again. They're close to re-tearing quite a few times. Listen, an ACL reconstruction surgery requires extensive physical therapy. We have professional athletes that take at least 6 to 9 months. So if you're a weekend warrior and you think you're going to be out there on the slopes after reconstruction and you barely do any therapy and you're not doing much, and you think after 3-4 months you're going to be out there skiing and doing stuff and playing soccer and basketball and you're going to have any complications, I'm sorry to tell you, you're going to have problems. Sorry. I've seen them. I've talked to them. And I don't know not one in 20 plus years that did well on their own. So one of the things that you could do is start a great program designed for somebody to help you with range of motion, help you with strength, help you with stability. And by the way, even non-surgical torn ACLs have done really well in the clinic. I've had them doing all kinds of stability stuff. In fact, their stability becomes so good that I bet you would not be able to tell that they don't have an ACL while doing things, especially in the clinic. You'd be surprised with their squat, their lunges, even their jumping and their landing. They're able to do some plyometrics. Yes, those people probably use a brace with skiing, with tennis, things like that, but they're out there doing it, and they did it non-surgically. Some of them get really super strong. The stability is pretty good. Yes, the ligaments are lax, but their muscles have to take over. So if you're in a situation where your passive system, meaning the restraint system like ligaments, are now functioning properly, then you're even more reliant on your active muscle system to support the joint. All right. So, question next question says, describe your assessment process for determining if an injured joint has fully stabilized, strengthened, and reintegrated to safely return to full duty activity. This has to do with people returning to work, and part of returning to work is actually returning to the field or court for a professional athlete. I have similar protocols for those kind of people, whether it's return to work or return to play. The bottom line is this: why are they here? They're here in my clinic because they were injured and they cannot do what they did before. They cannot return to their occupation safely. I don't care if it's a secretary, a marketer, somebody that does office work. If they can't type and they can't sit for X amount of time to do meetings and phone calls and this and that, well, then they can't return to work. It's not different than they can't dunk a basketball or catch a football and avoid a 300-pounder knocking their heads off. So I have to be able to get them to a point where I check them and they're pretty much checked, not just the first visit. Every subsequent visit, when I put my hands on my patients, I'm checking things. So it's not a surprise where they are in 4 weeks, 6 weeks, 8 weeks, 12 weeks, 6 months, 9 months, or a year. Doesn't matter if they had surgery or not surgery. I'm constantly monitoring their progress. So the return to work criteria is, can, after all the things that we do with them, strengthening, balance work, stability, the homework that they have for stretching and things like that, they're self-aware of posture, maybe we got an embrace or orthotics, whatever. The point being is, once they've done all that, the ultimate test is, can we reproduce in the clinic the factors or environment that will return them to work? So we have running drills. We have all kinds of things to check the athlete. Can they do their sport properly, effectively, without further injury? Then if the answer is yes, 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 then I know they got stronger. I know their stability returned. I know all their mechanisms of brain and body are connected again, and they're able to do things. So the criteria is, can they reproduce what they couldn't do before they got here? So can they sit there and type? Can they be at the computer for, 8 hours a day? If their answer is now yes, and they could do it safely without major complications, then I know that they've stabilized, strengthened, and improved. So I'm comfortable sending them back. If there's a complication, if they're almost ready, but not quite ready, then these things are just tests, right? And I know that they need further work. And to my worker or to my athlete, you understand that you're not ready to return. So we don't have to argue. If you can't do something effectively and safely, then you know you can't return. And your heart could tell you all day, but I want to, but I want to. Is it going to be good? Probably not. So what's there to argue about? So maybe we need another 3-4 weeks. Maybe we need another 8 weeks. Maybe we need 12 weeks. I don't know. Every case is different. However, I do know that you didn't pass the test. And if you didn't pass all the tests in function, then there's really nothing to talk about. We have to continue. If you did, shake hands. We say, thank God, God bless, and have a good time. Enjoy yourself. We wish you the best of luck. And fantastic. We move on. All right. When dealing with concussion patients, what physical markers or metrics demonstrate brain function has harmonized, allowing a return to cognitive and physical workloads? So I get these. I get them a lot, and they manifest in different ways. I have athletes that have had concussions on the field, on the court, wherever. and they still have headaches, nausea, occasional blurred vision. They're sensitive to sound. They're sensitive to light. Guess what? You can't return. That means your brain has not organized enough in the healing process to tolerate all of life's environmental functions. Let's say your memory's still a little bit off, maybe a little bit foggy with counting or Sudoku puzzles, which I loved giving different level homework assignments for my concussion patients to get them to think, counting backwards, doing things that, make them process information. I do memory recall things. So I'll give them objects to remember in the beginning of the session, and a certain period of time later, I ask them to recall it. And if they can't recall it, then can't pass. So you're not ready to return to work. These are some of the protocols. You're not ready to go back to a contact sport, especially with the chance of having a repeat concussion, which literature shows that are very detrimental. Repeat head trauma is potentially life-threatening. So we're not going to deal with that. We're going to make sure that the symptoms have gone down. Now, obviously, if their memory has come back, they're thinking fairly clearly, but they're hiding and masking headaches or dizziness, things like that. Not much I could do, but I make sure that I give a pretty good lecture on the consequences of repeated head trauma. I've had attorneys walking down the street, looking at their phone, so deeply enriched in their case, and walk into a telephone pole and hit their head, and had months of symptoms of concussion. Some of them also have problems with vertigo and dizziness, with different things, not just positionally turning their head, but basic things, still sensitive to light and sound. So if you're in public and have a big court case and you can't really sit there because the lights are bothering you, the people talking are bothering you, you're having a stress reaction because the judge is yelling at you and you just can't function, we have to still work on things. Okay. So it may not be the best environment for you. You may not be ready to be set free with those concussion symptoms still going. So yes, athletes have to be more honest. The general public is pretty honest of what's going on with them, especially with symptoms. But, with athletes, we have to take some of what they say face value. I will pick up on certain things of body language, things like that, and I'll try to push the rehab a little bit longer, just so I'm not seeing what I think I'm seeing, and I believe that they're fibbing a little bit. But ultimately, they can't hide certain things. So we have to be very proactive with education and make sure that they understand if they're returning back to a physical contact sport. Excuse me. All right. For physicians and training, what common oversights delay proper differential diagnosis and treatment plans for sports or repetitive strain injuries? I think for young physicians, I think they sometimes overlook what happens with repetitive micro trauma. We're always looking for macro trauma, like this big thing that happened when we talk about injuries. Sometimes we just we're lackadaisical with repetitive stress. And, sometimes we kind of dismiss certain basic things. Look, there's people who have repetitive injury, like students, for give an example, with backpacks. They put in a backpack a certain way, they weigh on one side, they slide off the same way, they keep sliding off the same way, and they come in, and then they're right-handed, so it's always on the right shoulder. They go play volleyball, or they go play baseball, or they're doing stuff. And then they wonder why that shoulder hurts over and over again. Same backpack, repetitive stress. And I think young physicians only look for sporting events or how they throw in the baseball or how they're actually, talking about how they're spiking. But what about the rest of the day where they're using that particular side? And it's often overlooked tremendously of some of the repetitive stress that occurs from daily life, even before the sport. So somebody with experience will get into deeper questions. You ask the right questions, you'll probably get the right answers. If you're just reaching and you ask a few questions and you think you know, and maybe you're off the wrong track, and you go through rehab and you go through things and you're not in your sport and you're feeling better. And all of a sudden, you're wondering why, not even returning to a full sport, the pain kind of returns. So you're lost. One of the good ways is to start looking at everyday life and how it contributes to some of their repetitive stress during their sports injuries. So it's a big factor. And I mentioned earlier with one of the other questions, if you're sitting behind a computer or sitting at a desk studying, and then you're off to practice and you go play soccer or volleyball or tennis, and you've been sitting there all day and your hips are off and you're slumping and slouching, you didn't eat all day, you barely had any water, and then you try to go to a 2-hour practice and do the same thing repetitively over and over again, well, your injury potential goes up. And that could, keep you from your sport that you love. So it's very important for new physicians to contact and, get good questions. Ask good questions of their daily routines and how they are and how they warm up, how they stretch, how they wear their backpack, when, how, what. So when you get into the daily activities a little bit more, you'll find that you'll get more of the story. And if you could modify those things a little bit and help them understand and how to modify some of the daily life, they'll most likely have less problems with some of the repetitive stress of the sport. Not completely. That's where, again, physical therapy comes in, modalities, stretching, healing things, strengthening, stability, those kind of things are very important. And that's why it's very, very important. So this has been fun. I always love doing these things because, I love my guests, and, the listeners get a lot out of the guests and they get a lot of our interactions together. But people seem to really love these one-on-one episodes with Dr. Slava. You get to be part of the show. You get to ask your questions and get your questions answered. So that's pretty cool. People seem to love that. Keep sending your questions, keep asking, because you make my show go round. So I love when you ask questions. I love when your people are involved. This is fantastic. Keep on doing it. And always thank you for participating. We love our guests. We love people that follow us. So comment, like, and let us know how we're doing. And we'll talk to you soon. Thank you.
Like and subscribe if you're watching us on YouTube. If you're listening, make sure to rate us on Apple Podcasts and Spotify. Thank you for listening to Time Is Now with me, Dr. Slava Shut. Remember, tune in every Friday at 2 p.m. and send your questions to Dr. Slava Shut on Twitter. Thank you, thank you, thank you.